What Parkinson's biomarkers do PET and MRI scans show? Imagine peering inside the brain to see the subtle signs of Parkinson's disease. PET and MRI scans are like high-tech windows that help doctors spot these clues. In Parkinson's, the main problem is the loss of dopamine-producing neurons in a part of the brain called the substantia nigra, and the buildup of abnormal proteins like alpha-synuclein. Biomarkers are measurable indicators that reveal these changes, even before symptoms become obvious. Positron emission tomography scans use radioactive tracers to highlight specific biological processes. One of the most important PET biomarkers in Parkinson's looks at the dopaminergic system. Using a tracer called fluoridopa, doctors can see how well dopamine neurons are functioning. When these neurons are damaged, the tracer's uptake in the striatum, especially the putamen, decreases. This pattern is a strong sign of Parkinson's and helps distinguish it from other movement disorders. PET scans can also measure glucose metabolism in the brain using fluorodeoxyglucose. Certain regions, like the occipital lobe, show reduced activity in Parkinson's, which can help differentiate it from similar conditions. Researchers are developing new PET tracers aimed at alpha-synuclein, the protein that forms Lewy bodies in Parkinson's. While these are not yet available for routine use, they hold promise for earlier diagnosis and tracking disease progression. MRI scans provide detailed images of the brain's structure. In early Parkinson's, conventional MRI often appears normal, but advanced techniques can reveal more. For example, iron-sensitive MRI can detect increased iron in the substantia nigra, which is common in Parkinson's. Volumetric MRI measures shrinkage in affected brain areas as the disease advances. Diffusion tensor imaging, a type of diffusion MRI, assesses the integrity of white matter pathways, including those involved in movement. Changes here may indicate early neurodegeneration. Another promising technique is neuromelanin-sensitive MRI, which visualizes the pigment neuromelanin in the substantia nigra. Loss of neuromelanin is a hallmark of Parkinson's and could serve as an early biomarker. Combining PET and MRI in hybrid scanners offers a more comprehensive view. These systems can simultaneously assess molecular activity and structural changes, providing deeper insights into how Parkinson's develops and progresses. This integrated approach helps researchers understand the links between brain changes and symptoms, and it can improve diagnosis accuracy. In research and clinical practice, these imaging biomarkers are becoming increasingly valuable. They help confirm diagnoses, especially in early or uncertain cases, and are essential for monitoring disease progression in clinical trials. They also assist in distinguishing Parkinson's from other similar disorders, guiding treatment choices. Moreover, advanced imaging might someday identify people at risk before symptoms appear, opening the door for earlier interventions. While these tools are powerful, they are not yet available everywhere, and some techniques are still under development. Scientists are actively working on creating more specific tracers for alpha-synuclein, which could revolutionize Parkinson's diagnosis. Combining multiple biomarkers from different imaging methods may also improve accuracy further. To sum up, PET and MRI scans reveal a range of biomarkers in Parkinson's disease, from molecular and functional changes in the dopamine system to structural and microstructural alterations in the brain. These insights are vital for accurate diagnosis, tracking how the disease evolves, and testing new treatments. As research advances, these imaging techniques will become even more precise and accessible, ultimately helping to improve the lives of those affected. Remember, imaging is just one part of a full medical assessment, so always consult healthcare professionals for personalized advice and interpretation of results.